Welcome to this HarmoniMD video tutorial on how to enter an imaging order and view results. A patient chart must be open to add an imaging order. You can see any imaging orders that have already been placed for the current visit here in the Chart tab. To add a new imaging order, first check to see if an accurate problem is entered. A quick view of any problems for the current visit can be seen here on the Chart tab. If the reason you are ordering images is not listed, first enter that problem. Having an accurate problem for whatever orders are being placed is critical for best clinical practices and for billing purposes. To add an imaging order, click on the Imaging tab. Once on the Imaging tab, you can see all imaging orders that have been placed for this patient, for both the current visit and for any past visits as well. To add a new imaging order, click here. This opens the imaging order window. Let's review all the fields in this window. The patient visit will autofill with the admit date and time. You cannot edit this field. The status field will default to active and also cannot be edited. Once the image has been taken, the imaging department will update this field to scanned. This field can also be used to cancel the order, which we'll look at in a minute. The Scheduled For field defaults to the current date and time. This is an optional field. Use this to schedule a test for some point in the future. As throughout the entire HarmoniMD system, use the Date button and the Time button to change the date and time. The Priority field defaults to Stat. Click the down arrow to view your other choices. Indicate the type of imaging order here. Click on the down arrow to reveal your choices and scroll through the list. We'll choose X-ray for this order. The order description drop-down list changes depending on what order type is chosen. Click on the down arrow to see your choices and use the scroll bar to move through the list. We'll choose Chest 1 View for this order. Next is the Order Instructions field. This is an optional area to enter any instructions. As with any order, an indication is required. This lists any problems entered for this current patient visit. It is a unique drop-down list for this particular patient for this particular visit. If the desired problem is not listed, go back to the Problems tab to enter it. If you try to save the order without entering an indication, it will indicate that it is a required field. We'll choose the problem listed. If you are the ordering physician, your name will auto-populate here in the Signed By field. If you are ordering on behalf of a physician, select his or her name from the drop-down list. And then also indicate whether the order was received verbal order read back, telephone order read back, or written. Then enter your PIN and hit Save. The imaging order will now appear in the patient chart, both on the Imaging tab and on the Patient Chart tab. Let's review a couple more things about imaging orders. We'll click on the Imaging tabs to go back to that window, and you'll see that the doctor's name is listed here on the order. If for some reason you need to cancel the order, simply click on the record, click on the status to change it to canceled, hit update, enter your PIN, and then hit continue. The status of the imaging order is now updated. Once the imaging order is completed, radiologist reports can be viewed on this tab along with a link that opens up the image in the PACS system. Click on the right arrow next to the order to expand the record and view these. So here we have the radiologist's report, and I can click on View Image to see the X-ray. To return to the chart, I can close this window or simply click on the tab to go back. Click on the down arrow to close this record's results. Use the Imaging tab to order new imaging tests and view results. And please remember to use an accurate problem when ordering. Thank you.